Imagine a world where you can walk into a pharmacy and get a COVID-19 vaccine without needing a prescription. Sounds like a convenient and straightforward process, right? But here's where it gets controversial. The state of Minnesota has just defied federal guidelines by issuing a standing order that allows pharmacists to administer COVID-19 vaccines to a broader group of patients than recommended by the Food and Drug Administration, FDA. This move has sparked a heated debate about the role of state versus federal authority in public health policy. But before we dive into the details, let's take a step back and understand the context. The COVID-19 pandemic may be over, but the virus is still circulating, and vaccination remains one of the most effective ways to protect against it. In fact, studies have shown that COVID-19 vaccines can prevent severe illness, hospitalization, and even death. So, what's behind Minnesota's decision to go against federal guidelines? According to State Epidemiologist Dr. Ruth Lynfield, the goal is to make it easier for Minnesotans to access COVID-19 vaccines. By allowing pharmacists to administer the vaccines without prescriptions, the state hopes to increase vaccination rates, particularly among vulnerable populations such as the elderly and those with underlying health conditions. But this move has not been without criticism. Some argue that the state is overstepping its authority and ignoring federal guidelines, which are in place to ensure public safety. Others claim that the vaccines are not effective or that they pose unnecessary risks. So what do the experts say? The American societies representing pediatricians, family doctors, and obstetricians have all recommended unrestricted access to the latest COVID-19 shots for people 6 months and older. And a recent study by the University of Minnesota found that COVID-19 vaccines are safe and effective, with rare and mostly mild cases of side effects such as myocarditis. But here's the thing. The federal government has been sending mixed signals about vaccination policy. The appointment of vaccine skeptic Robert F. Kennedy Jr. as health secretary has raised concerns about the politicization of public health policy. And the Centers for Disease Control and Prevention's CDC Advisory Committee on Immunization Practice, ACIP, has been criticized for ignoring scientific research and recommending against COVID-19 vaccination for certain groups. So what does this mean for the future of public health policy? Will other states follow Minnesota's lead and defy federal guidelines? And what are the implications for vaccination rates and public health outcomes? These are all important questions that need to be addressed. As Dr. Michael Osterholm, director of the University of Minnesota's Center for Infectious Disease Research and Policy, said, sadly, the ACIP we knew has been hijacked and is today an ideological body and no longer a scientific one. The controversy surrounding vaccination policy is far from over, and it's essential that we have an open and honest discussion about the science, the politics, and the implications for public health. So we want to hear from you. Do you think states should have the authority to defy federal guidelines on vaccination policy? Or should the federal government have the final say? Share your thoughts in the comments below.